Hello everyone. Well, it's bonfire night again already somehow, and we're having lots and lots of requests for sedatives for animals that get really stressed at this time of year. So I thought it would be really useful just to have 5 minutes looking at how we can treat stress. We're all aware of stress in our lives, stress in our animals' lives, and the best way, I suppose, to treat it is to try and remove the source of that stress. So, we look with dogs and cats at desensitization programs, keeping the environment the same, etc., etc. But actually, this morning I wanted to talk more about the actual pharmacological or the drug treatment of stress, because there are lots of things that we can do. And a lot of people ask for sedatives when I think they probably want something else. So what are the three classes of drugs that we look at when we're looking at stress? We're looking at essentially hypnotics, sedatives, and tranquillisers. I suppose it's a little bit of an old-fashioned sliding scale, and some drugs can fall into different categories depending on their dose. But essentially the three categories break down like this. Hypnotics are drugs which actually cause sleep. So sleep enhancers or even general anaesthetics. When someone talks about taking a sleeping pill, generally what they're talking about is talking about taking a hypnotic type drug, and we'll come on to those in a moment. Sedatives are basically next sort of level down the scale. A sedative would generally reduce an individual's drive to do something and generally results in reduced mental alertness. And finally, a tranquilizer is designed to produce a more stable emotional state, essentially reduce the extremes of emotions, neither very, very hard nor very, very excited nor very, very stressed. So it's sort of a sliding scale with hypnotics at one side, sedatives and tranquilizers down at this end. And like I say, a drug, depending on its dose, can kind of be anywhere on that scale. So what are the kind of drugs that we can use on that scale? So if we start at the very highest, sort of hypnotics, well, we've got our general anaesthetics, so propofol, mainly that we use these days, but we used to use barbiturate anaesthetics. Less so ketamine. We tend to use that more in cats. In people, it's used in kids. At lower doses, it can produce a sort of dissociative state. It's called dissociative anaesthetic. So rather than just being asleep, it's almost like being in a dream. You feel very, very detached from reality. You're not feeling reality at lower doses of ketamine. Something we don't use in, or isn't used in people, are alpha-2 agonists. And when you book your animal in for a sedative procedure, so sedation to, I don't know, maybe look at a grass seed, or sedation to take a blood sample, we tend to use these alpha-2 agonists. These will make an animal immobile. They will severely reduce its mental alertness, but they won't be completely asleep. They'll still be aware, dimly aware of things that are going on around them. But crucially, they can still feel pain and they can still feel anxiety and worry about things. So an alpha-2 agonist will do this. ACP, which is the little yellow tablets, or sometimes we give it as an injection. It's a yellow injection we give for preoperative medication. Very much the same effects. So it produces a profound state of reduced alertness, but crucially, animals can still process things and they can still have the emotional states emotional feelings whilst they're in these states. So occasionally we give these drugs out to animals for fireworks, and that yes, that they'll work, they'll keep the animal quiet, but the animal will still feel that worry and that anxiety within them. So some people say it's not fair to use ACP on its own, because essentially you're producing an animal which can still feel the emotions of anxiety but can't express any stress responses. Essentially, it's just sedated but worried. So not great, really, but still useful. Next down the line, tranquillisers. Well, tranquillisers is a bit of an old-fashioned term now, I suppose, and we break it into a few different sections. So we've got our anxiolytics, so things that sort of break down anxiety. I suppose that's the vast majority of tranquillisers. And then we have our antidepressant type drugs, which can have anxiolytic properties. So drugs that are in this class are Xanax or alprazolam, which is the same sort of family as diazepam. Again, just produce that sense of calmness or almost like an emotional numbness. We can also use drugs like sertraline, which is a drug which basically stops anxiety being able to, the emotional anxiety being able to be formed within the brain. We've then got our specific serotonin reuptake inhibitors, such as Prozac, which again can just help to lift mood a little bit. And then we've got our older tricyclic antidepressants, sort of Clomicalm is the trade name, chlorpromazine. And again, these are designed to try and elevate mood a little bit and prevent those feelings of anxiety. However, the holy grail, I suppose, of these kind of drugs is having a drug which doesn't make you feel completely emotionally numb the whole time, and at the same time doesn't have a sedative effect. Sometimes we find with these drugs, the higher the dose that we give, we start to push them from being simple tranquilizers into sedatives. So when we look at stress in animals, we've got a whole menu of drugs to choose from, and it's very much about the animal, that your pet, what sort of signs they're showing. So for instance, a dog that is really, really worried and stressed and destructive around fireworks, well, we might use a combination of something like Xanax to make them feel more relaxed, and ACP to actually make them feel sleepy as well, so they're not destructive during this time. An animal that is maybe not destructive but perhaps just pants, wants to sit on your lap, well, we might look at something like Xanax on its own to treat that. If an animal isn't worried about something, but perhaps is really, really reactive to fireworks, then maybe a sedative is, they sit up there barking excitedly, then perhaps a sedative on its own might be the way forward. And ACP tablets or alpha-2 agonists, Cilio or oral gel is something that came on the market in the last couple of years. They're really quite useful for those kind of for those kind of animals. In the run-up to these sort of times, so coming up to bonfire night, when perhaps you're using desensitization MP3s or CDs like the ones we've got on our website, we can use a combination of drugs. We can use a combination of propranolol, which reduces anxious feelings, slows the heart rate down, drops the blood pressure, along with a low dose of phenobarbital, which is a barbiturate anesthetic, but given at very low doses, to essentially reduce again those feelings of anxiety over a period of time. And then what that allows the brain to do is to learn that those pops and bangs and screams are actually okay. And so that combination of drugs given for a number of weeks, along with the desensitization training, can be really highly effective at basically training your pet to not get worried about pops and bangs. Long-term drugs, well, those sort of protocols we've talked about, not great for animals on a day-to-day basis, because they will produce an animal that is sleepy. They will produce an animal which essentially they're not themselves, because they will have a certain amount of sedative effects. So we can look at using sertraline, or which is called Lustral or Zoloft in the US, or we can use Prozac or Clomicalm on a day-to-day basis to try and reduce those feelings of anxiety. But those drugs aren't particularly brilliant when it comes to a point in their lives where there is a really, really anxious 24, 48 hours, such as around bonfire night. So it's a complicated area. There are lots and lots of different drugs that we can use, and not every drug protocol suits every animal. One thing I didn't mention was cats. If your cat gets very, very stressed in the car, or gets stressed, coming to the vets, and gabapentin, which is a painkiller for pain which arises from the nerves, and we use it a lot in people with whether you've got back pain or perhaps some kind of spinal issues, and we use it in animals with similar type problems. So if they've got a prolapsed disc or something like that, gabapentin can be really effective in cats, causing a mild state of sedation. We find that giving a capsule before they come in can really help cats not to get worried about the journey, not get worried about blood tests, etc., etc. So something to bear in mind. But yes, very much a matter of tailoring the medication to the need and the animal and what they're like around around periods like bonfire night, or just in general day-to-day life, and also bearing in mind any kind of health problems they might have. So animals that have cardiac or pulmonary lung complaints, generally not a good idea to give them a strong sedative. Hope this helps. Any questions? Pop them in the comments below. Thanks very much. Bye.